everyone, my name is Leah Opperman from the Daily Princetonian, and I'm joined here today by Dean of the College, Jill Dolan, and Assistant Vice President for Environmental Health and Safety, Robin Izzo. Thank you guys so much for joining me here today.
Thank you for inviting us, Leah. Thanks.
Thank you.
Of course. So let's just dive right into the questions. According to the university's COVID-19 dashboard, the campus positivity rate has remained quote unquote high throughout the past few weeks, although it started to decline. Despite this, the university lifted the under 20 person restriction, lifted the restriction prohibiting eating in dining halls, and began to allow travel outside of Mercer County again. Can you walk us through what factors went into those decisions?
Sure, I can start with this. So when most of those mitigation strategies that you mentioned were ones that were either put in place at the end of December, when we started to see a spike in cases, or else in early January that we put those in place. And the intention was that we wanted to be a bit more protective during that move-in period. We know from our experience with the spring semester of spring of 2021 and the fall semester 2021 that we often see a spike in cases, higher positivity rate among the students that are returning. And so in order to try to limit that spread, we wanted to try to limit a bit of movement, and especially limit the amount of time that people would be unmasked around other people. And our intention was to keep those in place until we could see through the first week of classes, see how things were going, and unless we were seeing a big spike or a huge problem, we were intended to loosen that up again. So it was really just being protective for that very beginning of classes. We didn't want to get off to a good start to make sure that we could continue with in-person classes. If Dean Dolan wants to add anything.
Sure. No, I think that's right. We were, one of your later questions is about, the spring semester being very much in process. And I think Robin's described exactly why we had to think of it this way. At the same time, I kind of want to start out here by saying we want the campus to be manageable for students and for faculty and for staff. And we all, I think, agree that all of these necessary restrictions that we've had to put in place have really compromised everyone's experience, including our own. I think we're proud of how healthy our population has stayed throughout this crisis. We only had to send one student to the ER, as far as I understand, and they were kind of sent back without needing further intervention. And that's really a good record over these past 2 years. So even though we all feel, I think at this point, that some of our decisions have seemed or felt punitive, I think they've been the right ones. And now we're looking forward to a new moment in our collective experience with COVID, which, as President Eisgruber said in his State of the University letter that just came out, I think yesterday, we're looking forward now to moving toward this post-restriction world, even if we can't move to a post-COVID world. And I think Robin and I and all of the administrators that we work with are very much looking forward to that having be our mantra going forward. That
makes a lot of sense, and I'm looking forward to the post-restriction world as well. But on the same note involving the COVID dashboard, isolation utilization has recently been at an all-time high, reaching 100% at a point. What efforts has the university made to deal with isolation hitting capacity? And in your mind, what are the advantages of indoor isolation versus specific isolation housing? And how is the university weighing those options?
So when we saw that our isolation facilities were really starting to fill up, we decided to go to the strategy of having people isolate in place if they didn't share a bedroom with another, a dorm room with another person, and we were pretty confident that the stock that we had for isolation would be able to manage the remaining part of the people that were not in singles. We'd be able to manage it that way. And if not, then we had plan B. We had additional planning that we had to manage that particular situation. I think that the isolation in place has worked pretty well. We have not gotten a lot of negative feedback about it. I think that there's an advantage that a person is in their own space. It's a bit more comfortable for them to be in their own space in many cases, and it was also nice to have their own, to have a more private space, especially when you're trying to do classwork and keep up with your classes during that time. Easier to do that when you have a room to yourself rather than having to, in some cases, some had to share a room or share more spaces. And so it was a bit more, it was a better, a bit nicer experience in that respect. And we did, although it does say, 100%, that's our primary isolation space, we did have other spaces that we didn't have to use because the strategy of having people in singles stay there really was adequate.
That's great to hear. Thank you. So on another note, in a recent op-ed in the Prince, Dean Dolan, Dean of the Graduate College Cole Crittenden, and Dean of the Faculty Jean Jarrett expressed their commitment to in-person teaching and learning. However, certain students and student groups have expressed their disappointment as to classes not having remote options for students who are sick or immunocompromised, but don't have COVID-19. I know that you, Dean Dolan, wrote about this a little bit in the op-ed, but I was wondering if you could elaborate on what you would say to those students.
Yes, thank you. Thank you for asking that, Leah. This is obviously difficult. I really appreciated, and Dean Crittenden and Dean Jarrett appreciated hearing from the Princeton Disability Collective and the grad student group who wrote and circulated the petition. And I have to say, I always learn something from campus activism. I've learned a lot, for instance, about disability activism from students like Naomi Hess, who's really brought a new lens to this work on campus, and from others who really push us to look from the perspective of people who are situated differently on the campus when we address all of these common issues. I think the issue here is that Princeton by nature is a really deeply residential campus, and that makes it different even from many of the campuses that we point to as our peers. We don't, for instance, permit students to attend campus part-time, and we require all students to be present in their classes for teaching and learning. Well, under COVID, obviously, we had to shift some of those practices pretty radically. And no one, of course, anticipated that virtual teaching and learning and all this Zooming that we continue to do would go on for as long as it did. And frankly, although I don't think it's a situation that any of us want to consider normal, we've learned some things in the process about how to combine virtual formats with residential teaching formats. And in fact, the McGraw Center for Teaching and Learning is thinking very deeply about the good things that happened during the pandemic vis-a-vis how we deliver content in a classroom that we might be able to move forward. But one of the hallmarks at Princeton is that we start from the presumption that everyone will be in class together, or if we're using online formats, that everyone will be using online formats. And that will happen at the discretion of the instructor, depending on what they think are the best pedagogical practices. So as we move now, hopefully, post-COVID, past the crisis moment of COVID, we're returning to a policy that requires anyone who can't attend class in person for 2 consecutive weeks to take a leave of absence, because that's the commitment we make to one another as teachers and learners. You simply don't get the same experience if you haven't been present in class. So that said, we know that people get ill. We know that some people do have to miss more than 2 weeks of class. When that happens, we know that some people do have to leave campus for a while until they're better. But there's the presumption that we'll be here together, learning, teaching and learning. And we also, I think another thing that we've learned from COVID is that people can protect their health with masks and with a really vigilant level of individual care and community care. So I hope that outlook will really help people who are sick with other illnesses like the flu or other viruses that are more dangerous for people who have immune compromised systems. Now, we're really trying, as we think about the post-crisis moment, to move into a perspective where it's that individual responsibility over institutional responsibility that will help us guide these practices. And the premise is really that the health of everyone depends on each of us thinking about ourselves in relationship to one another. So that means protecting ourselves with masks and whatever other strategies come to hand, but also being respectful and empathetic of people who need a special kind of care when they're in our classrooms or in our common spaces. No one should be shamed for wearing a mask, even when we're lucky enough to drop the mask mandate on campus, because people should do whatever they need to do to be able to protect themselves and their health. So I realize that doesn't change a policy that I think the Disability Collective was arguing against, but I hope it better explains why we feel it's just a fundamental part of the Princeton experience.
On a similar note, I know that you mentioned this a little bit in the first question, but in last month's undergraduate town hall, you stated that, quote unquote, the policy for the beginning of the spring semester is still very much in progress. How do you expect the current policies to change throughout the semester? And can you imagine a world in which we eliminate either masking or asymptomatic testing at any point within the semester?
Well, I would say, as I referred to President Eisgruber's letter, which I think the timing on the release of the letter was just perfect, because those first few paragraphs really intimate the trajectory that I think we're all hoping to follow this semester. So Robin and I were just at a meeting this morning with various senior leaders, and we were all expressing, one, I think a kind of optimism, but also really a determination that we're going to be able to move more quickly to lift some of these restrictions. At the town hall in January, which I was trying to remember when it was, I think it was at the beginning of the month, Omicron was moving really quickly. We weren't sure what was going to happen when students returned to campus. As Robin said, that's why we decided to phase students' return so that we could effectively test everyone and record our case counts and organize our isolation units, all of which are also mandated by state requirements. But what we needed that data to be able to say, here's where we're at, and now where can we go? I think that's the point we're at. We just finished the second week. I don't know the date. I think this is the second week of the spring semester. So 2 weeks into the spring semester, here we are, we've done the testing, we're seeing the case rates drop, isolation is starting, we don't have as many students in isolation. So that's letting us look forward to the spring. You know, it's been difficult to predict everything through the course of this disease, but now that we're able to track this data, and now that the students are back and we see that the trend lines are moving in really positive directions, I think it makes us be really hopeful about being able to lift some of these restrictions in a nearer future rather than a farther out future. Robin will amplify here, I know.
Yes, no, I definitely completely agree with everything that you said. You know, there are certain things that we're going to have to continue to do from a public health standpoint, and in some cases because to follow certain rules from say the state, or particularly at the state level. Isolation and quarantine are good examples of that. You know, we can't just decide, well, we're not going to have people isolate if they test positive. But we do absolutely see that getting to a point where masks would be, say, recommended rather than required, still be available to people. And I think, you know, getting to that point is going to make sure that a lot of some of the things that Dean Dolan mentioned before is to being mindful that there are people that are part of our campus population who are a bit at higher risk, and that there are people who are going to continue to choose to wear a mask on a regular basis, and we shouldn't make any assumptions about that, or really pass any judgment about someone who is wearing a mask. I can see us transitioning the testing program, going to a reduced frequency of testing, and eventually to more of a voluntary testing or symptomatic testing. All of this is going to require that, you know, some of the things this is dependent upon is that our vaccines are continuing to be effective against serious disease, and that the cases, that we'll always have to keep an eye on the number of cases that we're seeing to make sure that, you know, we don't, that we might have to, bring up mitigation if we're starting to see that there are so many cases that it's affecting absenteeism for classes, or the ability for staff and faculty to be able to continue, for business continuity reasons. If there's just so much, that's when we might have to sort of lift it a bit up again. But we do want to be, be able to be a lot more flexible here with, we want us to get to that point quickly, as quickly as possible, to reduce all of these mitigations.
One of the things that actually some of the rhetoric that's really moved me around the pandemic, I think this came up in Dr. Melissa Marx's interview that was posted on the website. I've learned a lot about the web of interconnection among all of us. So some of what Robin's saying about how we track our mitigation choices and our restrictions is so much about what's happening on campus, but also what's happening in the community. It's the hospitals and the capacity that they're at, and the ICUs, as well as the rest of the nation. So that sense that we can't make choices or decisions in isolation, but really have to be considering what other parts of the community are doing and the numbers that they're facing in ways that might not be as readily apparent, but that is part of this individual responsibility to a larger community. That mindset, I think we're trying to shift one another toward.
Absolutely. Both of your answers make a lot of sense. And Dean Dolan, I know you've spoken at length before about the importance of mental health as a priority for the university. Would either of you say that there are specific lessons on mental health management that the university has taken away from last spring?
I will address this first. I know that I speak for myself and my colleagues in the Office of the Dean of the College, and also for VP Calhoun and our colleagues in Campus Life, when I say that we all take student mental health really very seriously. And that was the case before the pandemic, when actually the numbers of students using counseling and psychological services on campus was starting to rise. We've certainly taken it seriously during the pandemic, and we certainly will after the pandemic. I very much admire Calvin Chin, the director of CPS. I think his outlook is enormously kind and empathetic and compassionate and very sober about what's happening here. You should know that VP Calhoun and I met just this week with the Dean of the Graduate School and the Dean of the Faculty to talk about how faculty can be partners for students in improving mental health and just extending the awareness of the importance of paying attention to mental health, not just in the co-curricular space, but also in the classroom. We're determined to make those connections for faculty and for students without compromising the necessary rigor of a Princeton education. I think we're all really eager to do that work together. That said, too, I think that we've been in crisis mode for 2 years. And as we move out of crisis mode and begin to feel COVID as endemic rather than pandemic, as the new language is saying, I hope too that perhaps some of the anxiety and the pressure and the concern and the despair and the fear that have really contributed to skyrocketing percentages of students who are experiencing anxiety and depression, I hope we'll all be able to kind of recalibrate a bit. I think that's difficult at a place like Princeton because it's a stressful environment to begin with. But I would like nothing more than for us as a campus, and that students and faculty and staff, to just take a breath and be able to say, what's happening with me here? Am I just having a bad day, or am I clinically depressed? I think this is an opportunity for us all to recalibrate what mental health means, I think, on campus. And I know that many of us are eager to start that project with students and, as I said, with faculty and staff.
Yeah, that's great to hear. Thank you for sharing. When it comes, well, I guess now looking towards the future, when it comes to COVID policies on campus, do you believe that things at Princeton can ever go back to the way they were pre-pandemic? Or do you think remnants of the policies are likely to stay in place indefinitely?
I think Robin and I probably both have lots of things to say about that. I think that things will go back to the way they were, although I also think that the campus and probably the country and the rest of the world we'll only move forward by incorporating all the losses that we've incurred from COVID and also everything that we've learned from COVID. And I mean that academically and intellectually and emotionally and everything else. That said, will we have a full and vital residential experience in our classrooms and in our co-curricular settings? I definitely think that we will. Will we return to many of our old rituals, some of which we did this year, some of which we'll do in a full way next year, like opening exercises and commencement and the P-rate and everything else? I think we definitely will. Might we still have vaccination mandates? We probably will. Flu Fest will have to probably be rebranded, or there'll be Flu Fest and COVID committee or some such. I think this is just going to stay with us in certain ways, but in ways that will become part of the rituals of the campus, just as all of these old rituals are. We'll see more masks on campus than we did before, but we'll be accustomed to them and they'll become part of the fabric of our lives again. So I am very hopeful about moving forward, not back to the old Princeton, but moving forward and incorporating everything we've learned to make Princeton continue the way I think we all want it to.
Yeah, I completely agree. I think that with everything that Dean Dolan said, and I think that we've learned a lot about of different ways to interact with each other, even using technologies like Zoom. And I think that's something that we're going to see stay with us. And one of the things I hope we'll see is that people will stay home when they're sick. So that, whether it's COVID, flu, or anything else, that people will stay home when they're sick more.
I think that's right. And I actually think even now we're at this funny moment on campus where every day I look at my schedule and say, what's in person and what's on Zoom, and yes. If Princeton were going back to the way it was before the pandemic, Zoom wouldn't even be in our vocabulary. And now we're at this moment where it's a little disruptive because I'm not sure where I'm supposed to be at anymore. But I think we'll start incorporating those practices. And one of the things we learned in the classroom during the pandemic is actually we can bring more people to us through this kind of technology than we ever did before. Some of our events are actually better attended virtually than they are when they're in person. So figuring out when it's good to be online, forming community together, and when it's necessary to have that sense of looking at one another's eyes and hopefully seeing one another's full faces in person when we do get to lift the mask mandates. It'll be interesting to see how all that works out and the choices that we make as a result. But I'm really looking forward to that being the challenge going forward.
That's great to hear. And those are both great answers. Thank you. And last question, also looking towards the future. I know this was answered a bit in the last question, but what is your best bet of what the fall of 2022 will look like?
I was on campus, well, I'm on campus now, but I was walking across campus, I guess at lunchtime yesterday, and I had my mask on because I was going to drop off my sample. But I saw all these students look at probably at my hair and kind of say, oh, I think that's Dean Dolan. I think that this is one woman actually stopped and said, Dean Dolan, I'm Chris. We've never met because we've only seen one another in these formats. So what I hope fall 2022 will look like is all of us back on helping the new students move into their dorm rooms in person, being able to see one another's faces so that we can recognize one another going forward, going into the chapel for opening exercises and being very, very hot as we always are, but being able to greet one another. I really hope that fall 22, even again, if we are wearing masks occasionally, or if we have vaccine mandates, that we'll be able to recapture so much of that serendipitous live encounter that I think is so much a part of the Princeton experience, that energy that brings us joy because we're helping one another unload the cars of first-year students. We're standing in line at dining halls and sitting at tables together. And because we're excited to be in the chapel at opening exercises, hearing the drums and seeing the flags and being at the pre-raid after that. that's what I'm looking forward to. And in my little utopian imagination, that's really where I hope we get, however modified that has to be because of what we've learned about COVID. What do you think, Robin? Is it a pipe dream?
I don't think it's a pipe dream. I'm hopeful for exactly the same things, and I hope that as long as I think that when I say we, I'm not talking about just here at the university, but I think as a when we look at our public health experts and everything, we've been able to respond. To develop vaccines and help and develop treatments and things like that have made us able to manage this pandemic pretty well, and for us to be able to be here in person. And I hope that continues, that continues, that we're going to see other variants, we're going to see some of these other things, and that each time we are able to meet that challenge. And so I'm hopeful that will be the case, and that we will have a much more vibrant experience on our campus. I'm really looking forward to seeing more alumni on our campus, bringing more people onto our campus, having more of these in-person events that we haven't been able to have in such a long time. Really looking forward to that. I think this is possible. I think that to get there, and besides some of the vaccines and all those sorts of things continuing to be very effective, and that people need to be able to talk more about COVID, and be more open about it, to normalize normalize it in the same way that the flu or a stomach virus, as far as how you talk about it. How we talk about it to each other, not is hearing that someone just tested positive for COVID and, oh, what did they do wrong? Being able to have personal responsibility to be, so that if somebody does get sick or become infected, that they're able to talk to other people and say, hey, we were together, and I just want you to know. So in the same way that we do with other communicable diseases like that we are able to talk about it that way and be open about it. I think that taking on that more personal responsibility and just openness is going to be really important for us to treat this as an endemic disease, and so that's going to also be very important. But I am really hopeful that fall 2022 is going to be have a lot fewer of these mitigations in place, and that it's going to feel a lot more like pre-pandemic.
You're here.
Looking forward to that as well. Yeah.
Yes.
Lastly, is there anything else that you guys would like to add or comment on?
I would say, again, it's really a pleasure that you asked us to have this conversation. As Robin said, I think it's really important to talk about COVID. It's important to talk about everything.
Yeah.
And really important that we talk about all of these practices as the Princeton community. I think, as Robin said, we're at this point because of how hard everyone has worked, because students have been testing twice a week, because everyone's been very diligent about compliance. We wouldn't be where we are if everyone hadn't pulled together as a community to make that possible. And these next steps, as we move toward them, will be because exactly of this community effort on the part of students, on the part of faculty, and on the part of staff. Robin is the prow of a ship that has been moving us through this storm, to extend the metaphor. There are so many people on this campus who have been working so hard to get us through these last 2 years, from everyone in EHS, UHS, the dining services folks, the residential college staff, the faculty. Everyone has been working really hard to keep Princeton until we can get to the point where this image for what we want fall 2022 to be will really be possible. So we've done it together. I'm looking forward to continuing to do this together and to keep the lines of communication open so we can make this happen and so that we can get through all the other crises that we'll no doubt confront together. We can get through those together too. So thanks to you and the Prince, Leah, for inviting us to talk and to let us use this as a vehicle to thank really everyone in this community for everything they've done.
Yeah, and just to add that, just again, thanks for everyone's patience and their grace. This has been difficult for so many people, and I know that there's a lot of fatigue over COVID, and just really appreciate the continued, the persistence and passion that people have been bringing to making sure that we are able to have this a really positive experience this semester, and to try to keep each other healthy as much as we can. So, but really appreciate and thank you. I really appreciate being here today and for helping to spread to amplify these messages. And so thank you for that.
Absolutely. Thank you guys both so much for joining me and for speaking with the Prince today. I've definitely learned a lot and I'm hopeful, looking forward towards the future of Princeton. Thank you guys.
Thank you.
Thank you, Leah. Thanks for having us.